Okay, so you popped a rib out over the holidays and you couldn't get in to see me. I'm gonna help you out. So first of all, when we pop or sublux a rib, we don't really know exactly what's going on. What might feel like a little pop and also we get some pain. Could be the costotransverse joint, could be the costovertebral joint. Anyway, we have pain in the thoracic region on the backside that is causing a lot of discomfort. And then we get this neuromuscular spasm that's trying to protect the area. And we get some compression, inflammation. If it's really acute, icing, heating, resting, using some kind of compression around the ribs can be very helpful. But say we're out of that subacute or we're out of that acute phase and we're kind of like, it's still stiff and it hurts to breathe. Here's a little sequence of exercises I'm going to help you out with. First off, foam roller, if you've got one. You can use a roll of towel to help mobilize it, but the foam roller works best. You're going to take it, place it not necessarily on the sore part. If it's too sore, you go above and below that. Mobilize those other joints to disperse the energy. Because a lot of the times when we pop or sublux a rib, it's hypermobile, so it's moving around too much. And all of a sudden the neuromuscular system grabs on and starts to spasm to try and stabilize. So if you directly try and push on that rib, you actually might make it more hypermobile. So don't do that, it's gonna cause more pain. Go just below that, or you're gonna go just above that. So when you're mobilizing that T-spine, you're gonna protect your neck. Your bum is anchored to the floor. Pull those ribs down with the abdominals. Deep breath in, exhale, let the shoulders fall. And what this is going to do is it's going to create a little bit of extension at a few segments at a time. But like I said, if you've got pain directly over the spot, don't mobilize that. We're going to try and stabilize that after. So we're going to create some mobility through the T-spine, work just shoulder level and then just below the last ribs there. So we're going to work that. Next, we're going to do some rotation. And you're going to really do this on the side that feels the most restricted. So you're going to get that foam roller, you're going to anchor knee on to protect your lower back. So the rotation comes in through more here, so you get that knee above 90. You're going to grab those lower ribs. If you can get the other arm up here, you can use a pillow, whatever you need. Grab those lower ribs, and you're going to lift and rotate away. Don't let your knee lift off that foam roller. It's anchoring and protecting your lower back. We only want the rotation to happen through the thorax here, through the rib cage. So you're going to take a deep breath in, grab those lower ribs, and lift. So you're going to do about 10 to 15 repetitions on this. And you'll notice that you'll slowly start to get more range of motion. You're going to work the side that is more restricted on this. So if you find that you're more restricted on the left and the right, you're going to do more reps there. Next, after we did some rib lifts, get rid of your foam roller. Now this will all depend on where the pain is. If you've got more discomfort in the upper ribs, you're going to go hand behind neck. If you've got more pain or discomfort in the lower ribs, you're going to go hand behind back. So we'll say that it's an upper rib, and we're going to take our hand, place it on the back of our neck. We're going to sit back. Again, we're going to lock up that lower back. I've got my elbow pinned onto my knee here to anchor that down. I'm going to lift the elbow to get those scap retractors. I'm going to look to the right. I'm going to look up towards the ceiling. Take a deep breath in. Come back down. Lift the elbow, look to the right, and rotate. Where the eyes go, the neck goes. Where the neck goes, the spine goes. So we're trying to use that reflex with the visual and the spine, the cervical system. And we're going to do 10 to 15 reps as that starts to stabilize on one side of the spine. Do both sides just to make sure things are stable on both. Lastly, we're going to walk them both in, and you don't have to go into a squat. You can sit in a ring. Okay, the key is put that lower back flat up against the wall. Tuck that chin, arms up. Find the range that works for you. If your hands are lifting off, just work in with the best that you can. But the key thing is ribs are down, back is flat, chin is tucked. Hands flat. I'm going to take a breath in. Go to where my mobility, where things start to tighten up. Exhale down. Inhale up. Exhale down. As you start to stabilize the spine, you'll feel more range of motion is going to be coming into the shoulders because we have better control along along the middle. So once we have good control along the spine, the nervous system starts to let go of those periphery or the extremities a little bit more. So people say that I got tight shoulders. I'm like, it might be an unstable neck, might be unstable T-spine. do some scap stability or some T-spine stability, and all of a sudden, oh, the shoulder's kind of free up. Hopefully that can alleviate some of the discomfort before you get in to see me. Maybe you do need some advanced manual techniques to help mobilize or manipulate that rib into a better position, and then do some more specific stabilization exercises. Either way, give this a shot. If it doesn't fix it, see somebody who can help you out. For the practitioners who are interested in learning more of these techniques and combinations of how to treat and help out their clients, the AMT system is going to be an excellent resource for you. Look for your next level 1 or level 2. Level 2s will be starting in 2020, but your level 1s, go on to thomaswells.com to see when the next level 1 is. Hope this helps. Shoot me a message, and don't forget to like and share.